Did you know your sleeping position could be silently working against your heart every single night? One simple change may help reduce the risk of stroke, dangerous blood clots, and thrombosis, yet most seniors have never heard this, not once. Before you sleep tonight, make sure you are not making this critical mistake. Poor circulation kills in silence. Every night, millions of adults over 60 are sleeping in positions that strain their hearts, restrict blood flow, and quietly lay the groundwork for stroke. Night after night, year after year, without a single warning sign, until it is too late. But here's what nobody is telling you. One simple adjustment to how you position your body at night can reduce your stroke risk by more than a third. No prescription, no expensive equipment, no complicated routine. I'm a cardiologist, and what I'm about to share with you today is something I wish every single one of my patients had known 2 decades earlier. Right now, there is one sleep position that actively fights the blood clots forming silently inside your veins while you sleep. One position that takes real, measurable pressure off your heart every single night. One position that works with your body's own anatomy instead of against it. And almost nobody over 60 is sleeping in it. Not because it's difficult, not because it requires anything expensive, but because nobody, not your doctor, not your cardiologist, not your specialist, not the person who sold you your mattress, nobody ever sat you down and told you the truth about what your sleeping position is doing to your cardiovascular system every single night. I'm going to change that today. The entire answer fits in one sentence, but that sentence needs the science behind it, or you won't believe it enough to actually act on it, and acting on it is everything. So stay with me until the end, because the position itself, the complete science, the exact setup, and the precise reason it works, I'm going to give you all of it, but only after I show you what's already happening inside your body. Because the science is what makes this impossible to ignore. And the science starts now. My name is Dr. Deborah William. After 60, your body produces nearly half nitric oxide it once did. Nitric oxide is the compound that keeps your arteries relaxed and your blood flowing smoothly. Half gone. Your body's primary vessel-relaxing mechanism running at half capacity every single night while you are completely unconscious. Tighter vessels, slower blood, more resistance, every single night. And slow-moving blood through compromised vessels does one dangerous thing above everything else. It clots. Deep vein thrombosis, blood clots forming silently in the deep veins of your legs, occurs 3 times more frequently in adults over 60. When one of those clots breaks loose, it does not stay in your leg. It travels into your heart, into your lungs, into the vessels feeding your brain. That is a stroke. That is a pulmonary embolism, and it happens while you sleep. Research found that nearly 72% of all strokes happen either during sleep or within the first 60 minutes of waking up. The most dangerous hours of your entire day are the hours you spend in your own bed. Now, I want to ask you something directly. Do you wake up more tired than when you went to sleep? Do your ankles look puffy before your first cup of coffee? Do your legs feel heavy for the first hour after you get up? Type yes in the comments right now if any of that sounds familiar. Those are not signs of aging. Those are signs that your circulation is being actively compromised during the hours your body is supposed to be healing. And I am going to show you exactly what to do about it. But first, what the wrong sleep position is actually doing to your heart. There are 3 positions quietly destroying cardiovascular health for millions of seniors every single night. There is a very good chance you are sleeping in one of them right now. First, stomach sleeping. the single most damaging position for any adult over 60. Your chest presses into the mattress. Your heart is being compressed from the outside while pumping from the inside. Cardiac output drops. Left ventricle workload increases, every beat working harder than it needs to for 8 straight hours. And when you're face down, you have to rotate your head just to breathe. That rotation compresses the carotid artery supplying blood to your brain for the entire night. This has been linked to substantially elevated stroke risk that builds invisibly over time. Second, flat back sleeping. It looks safe, it feels neutral, it is neither. Sleeping completely flat dramatically increases sleep apnea events in adults over 60. Every time breathing pauses, blood oxygen drops and blood pressure spikes. Those spikes damage artery walls. Repeated every night across years, that damage accumulates silently until one morning it does not. Third, right side sleeping. Your liver sits below and to the right of your heart. Sleeping on your right creates upward mechanical pressure, reducing how fully your heart fills with each beat. Less filling, less efficient pumping. Your heart compensates the only way it knows how, by working harder. Your lymphatic drainage system, which clears inflammatory waste from your tissues, also runs primarily on the left. Sleeping on your right fights that drainage. Inflammatory waste accumulates. Chronic inflammation drives arterial plaque, narrowed vessels, restricted flow. Stroke. 3 positions, 3 mechanisms, all pointing to the same silent damage happening night after night. Now, let me tell you about Caroline. Caroline is 72. Retired teacher from Ohio. She came to me after nearly a year of waking at 3 or 4 in the morning with her heart pounding, fast, irregular, frightening. Every test came back normal. Her cardiologist said anxiety. Her GP said cut the coffee. She sat in my office looking like someone who had quietly stopped expecting answers. I asked her one question nobody else had thought to ask. Which side do you sleep on? My right side, my whole life. I asked her to try 2 weeks on her left side instead. 3 weeks later, she called my office. The palpitations were completely gone, sleeping through the night for the first time in nearly a year. She said, "Why has nobody ever asked me that before?" Because sleep position falls into a gap that nobody owns. Not the cardiologist, not the GP, not the specialist. It simply never comes up, and patients pay for that gap every single night without knowing it. This was not complicated medicine. This was anatomy doing exactly what anatomy does when you stop working against it. So here it is. Sleep on your left side. Left side with elevation, with the exact setup I am going to give you right now. The reason it works is written directly into your anatomy. Your heart sits slightly left of center. Your aorta, the largest artery in your body, curves left and downward as it exits the heart. When you sleep on your left side, gravity assists your heart. Blood moves in the direction your aorta naturally curves instead of against it. Research found left side sleeping improves cardiac output efficiency measurably compared to right side sleeping. Your lymphatic system drains inflammatory waste more efficiently. Less inflammation, less plaque, lower clot risk, lower stroke risk. A cascade working automatically in your favor every single night. But left side sleeping alone is only the foundation. What I'm about to show you next multiplies every benefit I just described and costs almost nothing extra. Most people have never been told this. Your nighttime blood pressure is a stronger predictor of stroke risk than your daytime blood pressure. During healthy sleep, your pressure should drop 10 to 20%. Cardiologists call this dipping. When it does not drop, when pressure stays elevated or actually rises during sleep, we call that non-dipping. Non-dippers carry more than double the cardiovascular event risk of normal dippers. Double. Upper body elevation at 15 to 20 degrees during sleep is one of the most effective ways to restore healthy nighttime dipping naturally without adding another medication. Studies following thousands of seniors over multiple years found those sleeping with upper body elevated at this angle had dramatically lower stroke rates compared to those sleeping completely flat. The researchers called the effect size clinically significant. One of my patients, a 75-year-old retired contractor whose nighttime blood pressure had resisted 2 medications for 3 years, elevated his bed with simple $30 hardware store risers. 6 weeks later, his average nighttime pressure had dropped 18 points. His cardiologist reduced one of his medications at the very next appointment. 3 years of adjusting pills, one change to the angle of his bed. That gap closes the moment someone decides to have the conversation. That is why I'm here. Here's the exact setup. Every element matters. Do not skip any of them. Element 1. Upper body elevation. Your entire torso elevated 15 to 20 degrees from the shoulders down, not just your head. Use a foam wedge pillow or bed risers under the head end of your bed frame. The head should sit 7 to 9 inches higher than the foot. Do not exceed 25 degrees or you will slide during the night and strain your lower back. Element 2, the knee pillow. A firm pillow between your knees. Without it, your top leg slowly pulls your pelvis forward during the night, compressing the major blood vessels through your groin and upper thigh. Compressed vessels mean reduced circulation to your entire lower body for 8 hours. Knee pillow keeps hips stacked, vessels open, blood moving. Element 3, rib cage support. A small pillow or rolled towel under your left rib cage just below your armpit. Takes pressure off your shoulder and acts as a gentle anchor, preventing you from rolling onto your back during the night without realizing it. Element 4. Head pillow height. This one most people get wrong. I had a patient, a 77-year-old retired nurse, who had suffered a throbbing headache every single morning for over a year. 3 doctors told her it was dehydration, blood pressure, just aging. She had been sleeping on a wedge with 2 thick pillows stacked on top, head elevated at nearly 40 degrees. At that angle, the arteries on both sides of the neck are partially compressed for 8 straight hours. Chronic overnight reduction of blood flow to the brain. 5 weeks after correcting the angle, the headaches were gone completely. Your head pillow must keep your spine in a straight, neutral line from neck to tailbone when lying on your side. Not angled up, not drooping down. Neutral. Test it by having someone look at you from behind. Straight line, neck to tailbone. That is your correct height. Before bed, the pre-drainage routine. 30 to 60 minutes before sleep, lie on your back and elevate your legs above your heart. Feet on the sofa arm, heels against the wall, pillows under your calves. Any version works. Hold it 15 minutes. This drains the venous blood that has been pooling in your legs all day back toward your heart and kidneys before you lie down. Research found this measurably reduced clotting factors in the blood overnight. It also explains something that steals sleep from millions of seniors, waking 2 or 3 times a night to use the bathroom. In many cases, that is not a bladder problem. That is fluid redistribution happening at 2 a.m. because it did not happen before bed. Move the drainage to before sleep, and those overnight trips often reduce significantly on their own. I want to tell you about Yvonne. Yvonne is 70. She had survived a pulmonary embolism, a blood clot in her lung, 16 months before she came to see me. On blood thinners, being monitored, doing everything her doctors asked. But she could not sleep. Every time she closed her eyes, some part of her was listening, waiting. She told me she would lie in the dark thinking, Is there another one forming right now, somewhere I cannot feel it? Her doctors had treated the clot. Nobody had addressed the conditions that helped create it. I walked her through this entire protocol. Left side, elevation, pillow setup, pre-sleep drainage. One element at a time so nothing felt overwhelming. 8 weeks later, she came back in looking different, lighter somehow. She said, "Dr. William, for the first time since the embolism, I actually want to go to sleep at night. I am not lying there afraid anymore." Her morning leg swelling, persistent every day since the clot, was gone. Sleeping through the night. Her hematologist had reduced her blood thinner dose at the last appointment. She said, "I thought I just had to carry the fear now. I did not know there was something I could actually do." There are thousands of people like Yvonne watching this right now, people whose conditions have been treated but never truly addressed, people who have quietly accepted fear as a permanent fixture of their nights. This is why I make these videos. Before your action plan, I need to say one thing I mean completely. You are not broken. I know some of you have been told by doctors, by specialists, maybe by people who love you, that what you're experiencing is simply what getting older feels like. That the swollen legs, the exhaustion, the restless nights, that is just 70. That is the price of the years. I'm telling you plainly, that is not the complete truth. Some of what you have accepted as inevitable is mechanical, and mechanical problems have mechanical solutions. Your heart is working right now with everything it has to keep you here. It does not need anything heroic from you. It just needs the right conditions to work the way it was always designed to work. You now have those conditions, and you can start tonight. 3 mistakes I see that will destroy your results even if you do everything else right. Mistake 1. Using regular pillows for elevation. They compress during the night. You start elevated and wake up flat. Use a foam wedge or bed risers. They hold their angle all night. Mistake 2. Elevating only your head. Stacking pillows behind your head while your torso stays flat creates neck compression, not elevation. Your entire torso must be elevated from below the shoulders. Mistake 3. Implementing everything at once. Add one element every 2 to 3 nights. By 2 weeks, every piece feels completely natural. Now your action plan. Tonight, just 3 things. Left side, pillow between your knees, legs elevated 15 minutes before bed. That is enough to begin. This week, order a foam wedge or bed risers. $40 to $70, less than one specialist visit. Works every night for years. Once your equipment arrives, full setup. Left side, 15 to 20 degree elevation, knee pillow, rib cage support, neutral head pillow, pre-sleep drainage. Every single night. Track every morning for 30 days. Ankle swelling, morning energy, overnight bathroom trips, mental clarity in the first hour. Write it down. Your body will tell you exactly what is changing. I want one commitment from you right now. 30 nights. Come back to this video in 30 days and tell me in the comments what changed. I read every single one because every person watching this matters to me as a patient, not as a view count. If this gave you something real, something your doctor has not told you, share it. Think of one specific person in your life right now. Someone managing high blood pressure, someone who had a TIA, someone who wakes up every morning with heavy legs and has simply accepted it. One tap puts this in front of them. You might be giving them something that changes their health in a way nothing else has managed. If you are new here, subscribe. Every week I bring you honest, practical cardiovascular health information built specifically for adults over 60. No products, no sponsorships, just the evidence and what it actually means for your life. Sleep well tonight. For the first time, you know exactly how.